Welcome back this afternoon. It is time to Ask the Vet, where we ask a local vet about advice in caring for your family pet. Joining us once again is Dr. John Faught from the Firehouse Animal Health Center here in Austin, talking about cats today. Who did you bring?
This is Penny Lane.
A Beatles fan.
Yes,
apparently.
indeed.
Yes.
Yeah.
Penny Lane is a foster cat, right? Or
she was from APA. Austin Pets Alive, adopted about 2 years ago.
Yeah, a little nervous.
Yeah.
Today.
Kind of not moving much, but just shaking.
Yes, very chill cat. But we're talking today about we had a viewer write in, Susan, whose cat got diagnosed with mange, and she thought that was a dog's disease.
One, and more commonly it is. We talk about mangy dogs, and we see them much more commonly with cats, but cats can, in fact, get mange. There's really two different types that we talk about. One being Demodex, and the other one called sarcoptic mange.
Okay. And how do you know if a cat has mange?
Well, usually the symptoms are going to be related to some hair loss, itching, some redness to the skin, that kind of thing. What we do is they're microscopic, so we end up having to take a little skin scrape from the skin and look at it under a microscope, and then you can see the mange mites themselves, and then depending on what they look like under a microscope, you can actually tell which type they are.
Cats like to venture outdoors. Where would they get mange from?
Yeah, so the Demodectic mange, which is similar in dogs, actually are acquired from their mother at birth, and all cats have some of them on their skin, but their immune system keeps them in such low numbers that you would never have them have a problem with it unless their immune system is diminished, and in which case those overproduce and start to have problems. The other, sarcoptic mange, is a contagious thing, and it's actually a public health concern for people because all mammals can get sarcoptic mange, including people, and so we always take that a little bit more seriously so that you don't end up getting them on yourself and have lesions.
Contagious to humans.
Correct.
From their pets. In what ways would you treat that?
Well, there's a couple of different ways to do that. There's some topical products that you can use. Actually, one of the flea and tick products that we use will treat some of the mange mites. There's also some other injectable drugs that we can give. Usually, the treatment is pretty easy. You do 1 or 2 doses, and that'll take care of it. But it's a lot of that depends on finding which type of mite you're treating, and they both have a little bit variance in how we treat them.
Right, because there's also ear mites, which are different from mange.
Correct. Yeah. So they're a mite nonetheless, but a totally different type of mite than the other two that we're talking about, and those actually live primarily in the ear canals and tend to just cause itchiness and inflammation in the ears themselves.
Yeah, all about keeping your pets healthy. This is Penny Lane once again joining us today. If you have a question that you would like us to ask Dr. John Faught from the Firehouse Animal Health Center, send us your question to askthevet@kxan.com. We'll try to get them on our show. Thank you so much for being here.
Thanks for having me.
All right, we'll be right back.